Bell's Palsy today,
Yeah.
and we're gonna try something new. This is basically we'll post the PDF, I think, from Yale University.
Yeah.
And it's outpatient curriculum. And so they're gonna start with the case. We're just gonna run through it. So a 41-year-old lady, she comes in. Her chief complaint is that she's got right facial weakness. She's got no headache, ear pain, fevers, chills, long track neurologic symptoms. You determine that.
She told you that.
Yeah, she did. She's a nurse. Vertigo, dizziness, or other cranial nerve abnormalities. She said she's not had any tick bites, has no animals. She has diet-controlled diabetes. She's on medications for hypertension and reflux. Heart's regular. Fundoscopic exam's normal. She cannot close her right eye. The right side of her face droops compared to the left, but she's able to lift the side of her mouth slightly on the right. The remainder of the cranial nerves are normal, as is her motor strength. Her ear is normal, along with her oral pharynx. So what's the diagnosis?
What's the differential diagnosis?
Yeah, differential diagnosis.
It's a lower motor now facial palsy, for sure, because her eye is also involved.
Yeah.
Yep.
So you think it's, say that a little louder. We're recording.
It's a Bell's palsy.
Yes.
Yeah, Bell's palsy, and you think that because, how do you differentiate that from a stroke with the facial weakness? Well, what on physical exam is a really good hint on that. Couple things maybe.
You said it.
You did,
Yeah.
right?
So
You
the
got my
eye
face.
and the
yeah, you're such a
forehead.
slower face. It's your forehead's involved. They may complain of numbness. In fact, they often do. But actually, when you do a sensory exam, they have full sensation. I think that's an
And
important
most of
one
the times they
too.
have this hemiplegia too, because it's more like the internal capsule with the facial nerve palsy.
Yeah, yeah. And then I think it occurs mainly in people like 40s and 50s. So that helps you too. It's a lower age for stroke and everything than what you would expect. But it often occurs in diabetics, is a very high prevalence group. Pregnant women, your immune system has to be somehow a little bit impaired, I think. So.
Yep. And so I think that it's basically an idiopathic cranial nerve palsy of the seventh
Which
cranial nerve.
means we don't know what the hell's going
Yeah.
on.
Oh shoot, what other functions does cranial nerve 7 do? So we think of face, but it also does taste, and ear. So interesting, I learned this from this. They said that, and I've never seen this, but they said the patient might come in and say that things sound louder because it doesn't,
Ramsay-Hunt syndrome.
it doesn't downregulate, that has a dampening effect on the stapedius. And the other thing is, and that's actually a bad sign, it's worse prognosis if the ear's involved, and the tongue. So they might have altered taste sensation is what they mentioned. I didn't know those, I've not seen those.
I think it's important to do an ear exam too, because sometimes like a herpes zoster can present that way and you might see vesicles in there. So that would help change, they could be hidden there basically, help change your treatment markedly. You would not
Excellent.
be wanting to throw you know what at them. We'll have to
Yeah.
ask them how
Yeah.
to treat it. But
But I think the looking for vesicles is really important.
Yeah.
And that is the other, one of the questions on here. What would you want to look for on a physical exam?
Other systemic or peripheral weakness as well.
Yeah.
So the stroke is always the other thing you're worried about.
That's
and so
right.
just to make sure they don't have other neurological symptoms that don't match with Bell's
Yeah.
palsy.
Exactly. And
Yeah.
then, so, and then also think about cranial nerve runs through the salivary glands, so
Yeah.
carotid mass, those sort of things. Although I think that'd be hard to confuse. Guillain-Barré, myasthenia would be in your differential. So like Van said, other neurologic symptoms, which also kind of leads to, do these people need neuroimaging? Now this is, okay, so there's like the book answer and
we
there's
can't
real
hear
life,
you
right?
guys, but you shake your heads.
Yeah.
But you are correct, so
I'd
go
say
ahead
no.
and say it.
No. Yes.
Yeah, if the patient not improving after like couple weeks, we start
That's a
thinking
good
about
point,
MRI
yeah.
at that time. But immediately we don't have any imaging.
Yeah, about 3 weeks, right? If it really is like you've ruled out all the peripheral things and everything too.
Exactly, yep.
There's something called Bell's phenomena when in a Bell's palsy when they actually try to close their eyes roll up in the back of their head.
That's a normal.
And you won't see
Yeah.
that usually in anything else, so that's a good physical exam thing to see. If they live in like the Northeast, We don't have that. What's another differential you gotta worry about? Another neurologic. She went camping and.
Lyme disease.
Lyme disease.
Yeah,
yep.
it was in the history. There's a lot, but no tick bites.
Right.
HIV
HIV, yeah.
can
that's
also
true.
be, but I would only do that testing in very
High risk.
high risk patients, or like the patient from the Northeast. You're like, oh, tick bites.
Right.
That seems reasonable.
Exactly.
No MRI up front. If they're not
Yeah.
getting better about 3 weeks, you should consider neuroimaging. And of course, if they have other symptoms that don't
Yeah.
make sense, that you think this might be myasthenia, or they have other neurologic symptoms that would make sense more for a stroke, then you would do that.
Some of these things, it's about onset too. So a stroke and bells both are like, they get there right away. Bells may take 1 to 2 days to really get to the maximum. But a lot of these other diseases, the timing and onset of disease is real helpful to you for your diagnosis.
So what should we tell this person? What should we do for them?
Just protect your eyes.
How do I do that, doctor? They make a Visine for that. But yeah, protecting the eyes is super
Very
important.
important.
Yeah, that's all, when I see these people, that's all
Ointment.
on top of my list is to
Yeah.
make sure that, because if you can't blink, you can't
Right.
lubricate your eye, you'll get a corneal abrasion.
Right, and I think even the facial nerve can affect tear production, saliva production. That may not look that way because they can't keep the tears in the eye because of the loss of tone there, and they may be losing saliva or food through their mouth, but they actually have decreased production, so.
Yep. So eye drops, and then at night, like a lubricating thing, and they may even need to physically close the eye.
Yeah.
What else should we do?
Anything that helps them get better? Helps
Geez, you
them-
know.
Steroids.
Yes, good.
Steroids.
Yeah. So who should get steroids? Probably everybody.
Yeah.
Unless you have a good solid reason not to.
Yeah.
And
And I
it's-
think the worse the disease, the worse it is. We actually had a patient of ours who's a diabetic here who got a bad Bell's palsy, and he was in the ER here, and they chose not to give him steroids because his sugars were uncontrolled. That was a poor benefit risk
Yeah.
decision because he still had sequelae months later, very severe sequelae. So it
Yeah.
probably could have done a lot better. There's a theory. It's the nerve is going through this and I forget my anatomy, but very small bony canal, and there's a lot of inflammation. Yeah, and the steroids help take away that inflammation.
Yeah, so they
help it
can-
recover, so it's not permanent.
Yeah, because I think if it swells in there, it just
Right.
gets ischemic and dies
Right.
essentially, and then you're left with this permanently.
Very
Ah.
disfiguring disease.
And the steroid is it's like 60 or 80 depending who you ask, and it's for 7 days.
Yeah,
So
it's okay.
yeah, it's not. It's a lot of steroid, but
Right.
it's not for a long time, and it's
Right.
not terrible. When they've actually done surgery and taken fluid out, they've been able to culture varicella. What do you guys think about antivirals?
Only in very severe cases like grade 4 or grade 5, where you cannot, there is no closure of the eye, then you can consider varicella.
Okay, so the answer was only in severe cases. I think that's fair.
I think that's fair, right? There's no evidence that antivirals help, but in a very severe case, I would have no problem trying it to give the
Yeah.
person. We used to use them all the time, and actually we've gone away from it. But again, remember, kind of the art of medicine is lack of evidence does not mean don't do it, but
I would also make
really think about benefit and risk when you do.
antivirals. Obviously, if you think they have
Yeah,
zoster,
yeah,
then absolutely you should do it. And I would probably still do steroids
yeah.
because I think the swelling's still there. And the data on the antivirals is sort of mishy-mashy. Like it was in vogue, out of vogue. There's been a recent meta-analysis, kind of in vogue. So you just
Somewhere in between.
yeah, exactly. And will this get better, doctor? And will it come back?
Maybe.
10% over 10 years is the recurrence rate. So a low probability.
Yeah, there may be a little genetic variant that gets that back. How about getting better? People
Yeah.
are really worried about this. They want to see a neurosurgeon. They want to. I've had patients really be upset with it.
Most likely.
Yep. I think about 80% get
85%
recovery.
get full recovery.
Yeah.
With maybe a little bit, but not
Right.
noticeable, and 70% have a full recovery.
Yeah.
So 15% fall into the poor prognosis category. And
Yeah.
of course, it's really bad because of the eye involvement
Yeah.
and those things. It's a big, huge thing for them. But so you remember those. But you have to remember most people get better and should be getting better by 2 to 3 weeks.
Yep.
Okay.
All right.
So questions, concerns? So summing it up, Bell's palsy is idiopathic seventh nerve palsy. The way to distinguish it from a stroke is eye and upper forehead involvement. When they come in, most people get better. You don't need to do imaging unless you suspect something else or it's gone on for a couple weeks. And probably most people would benefit from the short course of steroids.
And you diagnose it by history and physical.
Yep. And
You do have to exclude some things, but
Yeah.
definitely.
yeah, some things to think about: HIV. Zoster,
Lyme.
tick disease, and then of course masses. But most of the time it's pretty straightforward. I think it's more of I find myself saying, well, should I use steroids or not? And I think right now the benefits
Absolutely.
are probably outweigh the risks, and then you can ask yourself about antivirals.
Yep. All right.
Short and sweet.